Good morning. My name is Amr Kais, and today I'll be presenting my research on the bacterium Neisseria gonorrhoeae. In 2018, the British Broadcasting Corporation, the BBC, reported a story about a British man who had contracted a form of incurable supergonorrhea. The World Health Organization and the European Centre for Disease Control both agreed that this was the first time in history that anyone had been diagnosed with this form of incurable supergonorrhea. Now, the occurrence of superbacteria, aka superbugs, is nothing new. However, the rate at which these superbugs are developing is alarming to say the least. People will get infected by these superbugs, and people will die as a result of lack of treatment. And we fear that this lack of treatment options will become the new norm. The effects of lacking treatment for a bacteria or even a virus can actually be seen throughout this COVID-19 pandemic. The lack of treatment means that doctors can only care for the symptoms without being able to cure the underlying disease causing those symptoms. And the dangerous ramifications of this reality can be seen throughout this global pandemic. However, as in the example of the British man, new strains of Super Neisseria gonorrhoeae are also appearing, and that is the reason why we decided to pursue this project. So today, I will be telling you about the fascinating discoveries made in this Neisseria gonorrhoeae project. Just to go back and give you some background on what Neisseria gonorrhoeae actually is, it is a species of bacteria that causes the infectious disease gonorrhea. And Neisseria gonorrhoeae contributes up to 100 million global cases of gonococcal infections every year, ranking as the second most prevalent sexually transmitted disease on Earth after chlamydia. However, strains of Neisseria gonorrhoeae have developed resistance to antimicrobial agents at an alarmingly fast rate. This has caused an urgent and worldwide demand for new drug therapies that can be used to combat these new multi-drug resistant strains of Neisseria gonorrhoeae. However, the current process of drug development is just unfortunately not that simple. The current process, from research and development all the way up to government approval, can take at a minimum approximately 10 years, as well as up to $2 billion just to develop a single drug. The resource-intensive process of drug development and discovery for these new resistant strains is time-consuming and just unfortunately will not be able to address the urgency of the crisis at hand. Therefore, we utilized a drug repurposing method in order to address the pressing crisis at hand. Drug repurposing is the process of developing or discovering new uses for a drug that already exists. This takes us back to the title of our project, teaching an old drug a new trick. By taking advantage of work that has already been done in the development of a drug for a different treatment therapy, we are not only able to expedite the approval process and alleviate the financial burden associated with the traditional method of drug discovery, but also drugs discovered through this repurposing method are actually more likely to succeed. This is because an already approved drug's toxicity and pharmacological properties are better characterized than newly synthesized compounds. If you look on the left, you can see examples of other drugs that were actually discovered through this repurposing method. Therefore, drug repurposing can be utilized to quickly respond to the rapid development of multi-drug resistant strains of bacteria, in this case, Neisseria gonorrhoeae. For this project, we wanted to know, are we able to find an old drug or drug candidate that can be repurposed to quickly and effectively respond to these new strains of multi-drug resistant Neisseria gonorrhoeae? To do this, we screened approximately 4,000 FDA-approved drugs. Screening is a technique in microbiology in which you expose several species of microbes, in this case Neisseria gonorrhoeae, to one or more chemicals or a set of environmental conditions in order to identify those that are sensitive to these chemicals or sets of conditions. Through this, we were able to identify 3 phenamic acids with potent antigonococcal activity. Phenamic acids serve as the parent structure for several non-steroidal anti-inflammatory drugs. The 3 phenamic acids that we identified are tolfenamic, fluphenamic, and meclofenamic acids. We wanted to see how potent are these drugs actually against Neisseria gonorrhoeae. In this table, you can see the results of our MICs of our 3-phenamic acids and our control azithromycin against 39 strains of Neisseria gonorrhoeae. MIC, minimum inhibitory concentration, is the lowest concentration of a drug that is required to kill 90% of the bacterial strains. Running an MIC is really the backbone of any microbiology lab. In this experiment, we used our 3-phenamic acids and our control azithromycin, and essentially the lower the number, the more potent the drug against our Neisseria gonorrhoeae strains. As you can see, tolfenamic and flufenamic were actually more potent than our control azithromycin, which is currently being used as a medication for gonorrhea. We knew that these 3-phenamic acids were potent against Neisseria gonorrhoeae. However, we wanted to know, what are the effects of these 3-phenamic acids against the human body and the healthy bacteria and the beneficial bacteria that live inside of the human body? In this next experiment, we ran an MIC of our 3-phenamic acids and our control, azithromycin, against the friendly bacteria, lactobacillus. Lactobacillus is normally a major part of a healthy vaginal microbiota, and that is why we call it a friendly bacteria, and that's why it's absolutely vital that the drugs that we're using do not inhibit their growth or kill these bacteria. As you can see in our results of our MIC, basing off the numbers that are higher, meaning they are less potent, and the numbers that are lower, meaning they are more potent, our 3-phenamic acids did not inhibit the growth or kill lactobacillus. However, our control, azithromycin, which I'd like to emphasize is one of the drugs currently being used to medicate gonorrhea, actually did kill and inhibit the growth of lactobacillus. Next, we wanted to know, how fast and efficient are our 3-phenamic acids for killing Neisseria gonorrhoeae? The way we find this out is by running an experiment called a time kill assay, which you can see above. In this time kill assay, we ran our 3-phenamic acids, tolfenamic, flufenamic, and meclofenamic acid against azithromycin, tetracycline, and DMSO. As you can see in the results, meclofenamic acid was able to eliminate and eradicate the high inoculum of Neisseria gonorrhoeae strains within 10 hours. And our other 2-phenamic acids, tolfenamic and flufenamic acid, were able to eradicate the high inoculum of Neisseria gonorrhoeae within 12 hours. These results are comparable to azithromycin, which was able to do it in 10 hours. Now that we've discovered that our 3-phenamic acids are potent against gonorrheal bacteria, they do not harm the friendly bacteria in the body, and they are fast killers of Neisseria gonorrhoeae, we wanted to know, will Neisseria gonorrhoeae be able to form a resistance against our phenamic acids? This entire situation arose due to the fact that the Neisseria gonorrhoeae was able to form a resistance against our drugs that we were using to treat it. So we ran an experiment called a single-step resistance assay, where we ran our 3-phenamic acids as well as a control, rifampin. Amazingly, in our results, we found that Neisseria gonorrhoeae was unable to form any resistance to 2 of our 3-phenamic acids, tolfenamic and flufenamic acids. This is evident by the low frequency of spontaneous mutation that you can see, which is less than 2.4 times 10 to the power of negative 10. Strains of Neisseria gonorrhoeae are rapidly developing resistance at alarming rates. To bypass the resource-intensive and time-consuming process of drug discovery, a drug repurposing strategy was utilized in which we screened 4,000 drugs, which revealed 3-phenamic acids that displayed potent antigonococcal activity. Many experiments were run on these 3-phenamic acids, and it is very evident from the results that these 3-phenamic acids serve as a potential new addition to the limited treatment options that's currently available for gonococcal infections, and these 3-phenamic acids warrant more research. I would like to acknowledge and thank my lab group, and especially my research mentor, Dr. Salim, for the opportunity to be part of a research project like this. And I would like to thank everyone that took part in this project. Thank you.